The government is planning to vaccinate more healthcare workers with one dose in order to provide them with partial protection at the very least. To give us her insights on this, Dr. Maria Consorcia Quizon of the National Immunization Technical Advisory Group, or NITAG, joins us on the line. Good afternoon, Dr. Quizon. First off, what would happen when a person does not get the second dose, or if the second dose was administered beyond the recommended time period? Would this really, lower the chances or efficacy rates further?
Well, first question first. No, there has to be two doses, at least for the AstraZeneca vaccine and the Sinovac that we have already. Okay, such that the first time we allocated, we saw to it that two doses are secured for each person. Now, what happens when we don't want to think that the second dose will not be available on the recommended time that it should be given, referring to the second dose. Now, what they are telling us now is that there could be an assurance of an incoming supply. For example, if a next supply of Astra is coming, then certainly we can use all of the first supply that came in, because we know with assurance, again, I will say with assurance, that in fact within the 4 to 12 weeks, which is the recommended interval for AstraZeneca vaccine, if in fact they come, then first in, first out, sure, why not? We can use already what is here on hand with us, considering the surge, and we need really to protect our health workers.
All right, because this is not the first time this has been suggested. Maybe first time here in the Philippines, but we've heard of it being done in other countries in the West. They said, basically that any protection is better than none at all, and they would rather spread this. You're also saying if vaccine supply is secure, do you have any reason to doubt that this supply forthcoming will really?
We do have reason to doubt, because we have been burned twice. First time they said that Pfizer was coming, and then they said Astra was coming the very next day after Sinovac, and you know that didn't happen, right? I mean, there are so many factors in play globally, such that personally for me, I think it's beyond anybody's pay grade in our country to really make sure which is coming, when it is coming. So this time, they're telling us that for sure, within the next few weeks or 1 to 2 months, a fresh tranche of AstraZeneca vaccine will come. And if, in fact, that is going to be that's secure, we're 100% that's sure, then why not? We can start vaccinating. It's the other countries' prerogative if they want to risk, that the second vaccine may not be ready within the prescribed time. Not ready, but I mean available within the prescribed time that the second dose should be given. That's them. They probably know that they will, more are coming. But as far as the Philippines is concerned, we want to make sure. Otherwise, we would have negated the gains that we got from the first dose. If the second dose is not given within the prescribed time, then we go back to square one. So it means that you're trying to do more, but in the end, you may not have. You may have to repeat, and vaccines are so scarce. We can't risk that. I guess that the first dose given to so many people will be negated because the second dose didn't come on time.
All right, thank you so much, Dr. Quizon, for being so candid. I just want to ask also if we're already seeing results from international studies on mixing two brands of shots or administering two jabs from different pharmaceutical companies. What are your thoughts on this?
As of the moment, the recommendation really is to give the same kind of vaccine. We don't mix.
All right, loud and clear. So it's just like, sometimes when they say don't mix, they really mean don't mix. Now, Dr. Quizon, what can you say about the current pace of our nationwide COVID vaccine rollout? Can we expect this to accelerate anytime soon?
Well, hopefully, because well, in the first place, no, we have about 1 million plus doses, the Sinovac and the Astra together, and based on the report of the Department of Health, more than 90% of these vaccines have already reached their destination. However, as of yesterday, I think less than 40% have actually been injected. But we have so many success stories because many hospitals, both private and government, are saying, there, we did it. We vaccinated 100% of our staff. So the vaccine is there. It's available. They reached already the places where they're supposed to reach. Now, it's in the ball is in the court of the receiving hospitals, how soon and how fast they can jab this vaccine.